So welcome everybody. I think we might have a few pop in a moment, but don't want to delay too much because we have a great presentation ahead of us. This is Managing Stress and Anxiety During a Pandemic with Dr. Hegland. We're very excited to have her do a webinar with us and hope that maybe we'll get a couple more here as the year goes on. This is a reminder that you are being recorded. So if you say your name when you participate or anything like that, please note that we are going to be posting this online. So if you're not comfortable with that and prefer to remain anonymous, feel free to use our chat feature and we'll leave names out. Also, please leave your microphone muted. It helps for the recording that if it is muted, we can't hear some of that background noise. And then if you do want to participate, please feel free to unmute your microphone or use the chat feature. So we do have some upcoming webinars. The next week we have one on direct primary care. For those of you who aren't familiar, direct primary care is a it's a payment model. So you receive all your primary care services for a monthly fee versus going through insurance. So if you are curious about this option, we do have information on our website, or feel free to pop into the info session. The following week, we will be talking about advanced care planning. So for those of you who have forms to fill out and want to make sure that your interests are really considered and accounted for if you're not able to speak for yourself, if you were to get suddenly sick or ill or injured, this workshop will help set you up to make sure that you're communicating those needs to your loved ones. We don't actually have anything on the schedule after that, but keep an eye on our website. I will be posting some maybe today or early next week with what our other sessions will be. If you have any suggestions or would like to see any other webinar topics, let me know. We're very open to feedback. So like I said, this is going to be recorded. So after the session, if you want to watch it again, or if you want to send it to a family or friend who might be interested, they are posted here about a week after. And if you missed any other recordings, feel free to check them out. I will be sending a survey after the session, so we love your feedback if you are willing to share it with us. So look for that email from me. And lastly, we are open for in-person office visits as well as televisits. You can use the chat feature on our website or call to schedule. We are accepting new patients from now till July 1st. Our hours are 8 to 5 currently, and we would love to see you. And if you know anyone who's looking for a provider, let them know that we'd be happy to be that for them. So with that, I'm gonna let Dr. Hegland take it from here. Dr. Hegland is our psychologist at our clinic through Jefferson Center for Mental Health, and she's been with our clinic for almost 5 years now, and we're lucky to have her as a resource. I know that as a health coach, I utilize her skills and resources all the time, and this is a big topic. Whether you've been dealing with stress or depression or anxiety before, a lot of people might be experiencing a different form of it or something new for the first time. And so I know that we're already well into the pandemic, but it's always good for reminders, and maybe this stuff will apply to some of the other things that are going on in the world right now. So with that, I'll turn it over to Dr. Hegland. Thank you all for being here.
Hi everybody, like Stacy mentioned, I'm Haley. I'm one of the behavioral health providers at the clinic, and I am going to talk about managing stress and anxiety during a pandemic. So Stacy, you can go to the next slide. So I thought we'd start by talking about kind of what is normal. What are people experiencing right now? As you can see from the slide, it's a lot of fairly negative stuff. Lots of fear, concern, lots of ambivalence. So maybe you're happy that you don't have to go into work, but also really worried and nervous about what's going to happen if you do leave your house. I've been hearing from a lot of people that they're bored. You know, I've had a couple people tell me that they've finished their home project to-do list, which I don't think has ever happened before. So people just have a lot of time on their hands. Lots of changes in eating, sleeping, either more or less on both sides. And then trouble with concentration. I think there's a lot going on. You know, people are just having a hard time working or doing their everyday things. On the kind of more negative end of the spectrum, you know, hearing from a lot of people that they're drinking more than they were. They're using marijuana a lot more than they were. Obviously, that's not a positive way of coping. You know, I can't stress enough how much, you know, people think, oh, it's going to help me relax. It really doesn't. It just kind of puts a blanket over the problem. So obviously not going to encourage that. And also some symptoms of depression or PTSD. So people feeling down, not motivated, just kind of blah, maybe sad, maybe more irritable and angry, things like that. I think that's kind of the range of what people are experiencing right now. Stacey, you can move on. This I included because I came across this during a Google search the other day, a little public service announcement from the CDC. I thought it was kind of a nice little reminder, so I'm going to kind of go through each one of these points to some degree as a way to kind of talk through some more positive steps that people can take. Stacey, you can advance. So the first thing on there was pause, take a breath, check in with yourself. I think probably the most helpful way to do that is through mindfulness. There are a lot of expanded free mindfulness resources right now that I'll have a resource sheet at the end of the presentation that I've kind of pulled together. When I talk about mindfulness, what I mean is being present in the moment, focusing on what's happening as it's happening instead of getting too caught up in your thoughts, worrying about the future, kind of what's going on in the world right now, that kind of stuff. So mindfulness gives a good kind of set of tools to help pull yourself back into the present moment, to kind of allow your feelings, be curious about them, don't fight them, don't drown in them, just kind of let them happen. So the Calm app and Headspace are two apps that I like to use with people that offer guided meditation. I think that's kind of the best pathway into mindfulness. They kind of walk you through what to do, how to be mindful, how to meditate. And I like these two apps because they also talk about the research behind mindfulness. Why are we doing it? How does it help? Like I said, they've both got kind of expanded free offerings right now, and I'll include links for those. The Calm app has got kind of a blog post that goes through all their free resources. They've got things for sleep. They've also got resources for kids. The Calm app is just really beautiful, easy to use. It's a nice one. Headspace, same kind of thing. They've got a collection called Weathering the Storm, free to everyone. It's got workouts, even sleep resources, that kind of stuff. Also right now, the full subscription is free if you are unemployed, if you're a healthcare provider, if you're an educator. So they're really trying to reach a lot of people, give them the tools that they're needing in order to kind of stay on top of their emotions. They've also got resources to use at work. So if you're a manager, you've got employees, to kind of all do that together. And I've had some clients say that they're doing that at work and it's really been helpful. They've also got articles to read if you're into that. Headspace has a little more kind of visual component. They've got little videos. We're going to do one in a second here. So if you're more of a visual learner, that one might be a better fit for you. My Strength down at the bottom of the page there is a website that my employer, Jefferson Center for Mental Health, has decided that it's important to give free access to both our clients and to the community. So I have some information on how to get hooked up with that for free, but they've got mindfulness. They've also got programs that you can work through for depression, anxiety, trouble sleeping, chronic pain, things like that. And these are meant to be kind of self-paced programs that you can work on whatever issue it is that you're having. They've also got other things for parenting, grief, just lots of resources. So like I said, I will send information on how to get hooked up for that. They've got an app, but I don't particularly love it. I think the website is best for that one. So these are resources that, all have free offerings, can help you learn how to be mindful, how to kind of let the snow settle in the snow globe of your brain so that you feel like you can think through what's happening, you can de-escalate your emotions, and be able to make more effective choices about how to deal with what's going on. So I think, Stacey, if you want to advance to the next slide, I've included a little, it's just 1 minute mini breathing meditation. This is from Headspace. As I mentioned, they do these little videos to kind of help illustrate the concepts that they're talking about. So I thought we could just do this one real quick if we can get it working.
So sitting comfortably, just taking a big deep breath in through the nose, out through the mouth. As you breathe in, noticing how the body expands. As you breathe out, just watching the body soften as you gently close the eyes. And rather than the mind leading the breath, allow the breath to lead the mind. Notice the sensation of the breath. Notice it where you feel it in the body. If you need to, you can just gently place your hand on the stomach. And just following that rising and falling sensation. Nothing else to do. Allowing thoughts to come and go. And when you're ready, just gently opening the eyes again.
That was 1 minute. The guy narrating that video was Andy. He's kind of the guy behind Headspace. He does a lot of meditations, but not all of them. So if you enjoyed his voice, Headspace might be something that you want to check out. So Stacy, we can go to the next slide. A really important thing for maintaining your mental health, being able to deal with your stress, is you need to take breaks from the news. This includes social media. Just walk away. It's okay. You need to know what's going on, but you want to make sure that you're getting your news from a reliable source. So on the resource sheet, I mean, I'm sure everyone's heard this already, but I've included links to the COVID-19 page for the Centers for Disease Control. They've got some good resources on, not only the health aspect of it, but managing stress, how to clean your house, that kind of stuff. So I've included that link. Also, the state of Colorado has a specific COVID-19 website that includes information about Colorado in terms of, what's going on in the state, where are we at in terms of quarantining, things like that. I'll include that link as well. So when you access your news, again, you want to make sure that you're getting it from a reliable source. We don't want to spread rumors that just kind of kick up fear and worry for people. It's important, again, to be able to step away from it as well. Being constantly connected is not really going to help you stay any safer. In fact, it's probably just going to stress you out. Chronic stress over time weakens your immune system. So you need to be able to walk away, go do something else, just kind of get your mind off it for a minute. Because again, it's not going to significantly improve your ability to take care of yourself. I think one thing that's been important, and this is something that Dr. Hammond has talked about, is be realistic and understand what your risk is. For the average person, the risk is pretty low of becoming seriously ill. If you're older, if you have underlying health concerns, then it's going to be a little higher. But you want to, do your research, talk to your doctor, understand where you are on that risk level, and also knowing how to reduce your risk. And these are things that everybody's heard before, right? So wash your hands for 20 seconds. I think as Dr. Hammond mentioned one time, if you're out and about, don't put your fingers in your eyes, nose, or mouth. Just don't touch your face. Wear a mask when you're out in public. Make sure to social distance. Cover your nose, mouth when you cough or sneeze with the tissue. Dispose of it when you're done. If you follow the guidelines for reducing risk, your risk is going to be reduced. So you want to make sure to understand, again, don't believe everything that you read on Facebook or whatever. Do your research, do your homework, talk to your doctor, understand how concerned you do need to be, and then again, follow the guidelines, taking care of yourself. I think that's it. Oh, if we can back up for a second. One thing too is if someone has successfully completed quarantine or isolation, they're not contagious anymore. And so it's gonna be the same as being around anyone else. So again, just kind of understanding how the coronavirus works and what you need to do in order to take care of yourself. Okay, now we can move on. An important piece of taking care of yourself is managing your physical health. Pretty much anyone that I've worked with has heard me talk about this. When you take care of your physical health, it reduces your vulnerability to negative emotions, right? So we're going to kind of talk through some things. The first one here being sleep. Lots of people are having trouble sleeping right now. If you can't sleep, there are lots of steps you can take. I don't have it on the slide here. And again, this is something that maybe people have heard before, but if you've been awake for more than 15 or 20 minutes, you need to get out of bed. If you're just laying awake in bed for hours on end, you're teaching your brain that it's okay to be awake when you're in bed. And we don't want your brain to think that. We want your brain to think that bed is for sleeping. So if it's been more than 15 or 20 minutes, get up, get out of bed. If you can leave the bedroom, that would be ideal. Go and do something soothing, relaxing, read a book that's not a murder mystery, do a Sudoku. The way I was trained, they told us to have people read their refrigerator manuals, like do something that's going to be boring and help kind of make you feel sleepy. When you're feeling sleepy again, try going back to bed. If you're really struggling to fall asleep, there's a list of things here that can help. Progressive muscle relaxation is one, and there'll be a link to a script for how to walk yourself through this exercise. Progressive muscle relaxation is an exercise that helps us reduce physical tension in our bodies. So when we're stressed, we tense up. When our body is tense, it tells our brain something's wrong. And our brain says, oh my gosh, what is it? So our body tenses up more, and there's a feedback loop that just keeps going around and stressing you out more and more. So with progressive muscle relaxation, we go through kind of all the major muscle groups in the body. Tense, hold it for 7 to 10 seconds, relax for 15 to 20 seconds, move on to the next muscle group. For things that are problematic, like between your shoulder blades, neck, maybe jaw, stomach, you can do a couple rounds of those, but I'll provide a link to a script for how to do this. This is a nice one to help you fall asleep. It's also a nice one to deal with anxiety or stress in the moment. And it's also a nice, just kind of preventative exercise. When done regularly, it helps reduce your tension and stress level. Another thing on here is doing a sleep meditation. Both Calm and Headspace offer options for this. Basically what they are is kind of like adult bedtime stories, like you're walking through a nice meadow, things like that, that have kind of relaxation scripts woven into them. They're really soothing. They're really calming. The nice thing about both Calm and Headspace is once they're over, they'll kind of turn themselves off. So it's not like they'll be running all night on your phone. Those can be really helpful. I've had people tell me, I want to know how the story ends, but I always fall asleep. So, I tried to listen to it in the middle of the day when I was awake and it put me right out. So those are good resources. Another thing you can do if you wake up in the middle of the night is count backwards from 1,000. This is kind of like counting sheep, just boring, gives you something to focus on so your thoughts aren't churning. And the last one on here is if you've got that anxious brain that just runs and runs and runs while you're trying to sleep, there's an exercise called the constructive worry exercise. I'll have a link for the worksheet for this. And basically what you do is in the early evening, sit down with the worksheet and kind of make a list of all the things that you are prone to worry about in the middle of the night. The worksheet that I'm going to send will then have a column for, do you have control over this? Yes or no? And then a column for, here are some of the things I can do to take steps towards addressing this problem. You fold it up, you put it on your nightstand. You don't look at it in the middle of the night. You just use it as a visual reminder. I've done what I can to address this problem right now. I'm not doing my best thinking at 2 a.m. I've already dealt with it, so I can let it go. And that's how it works. That one, again, not a perfect problem solver, but does help you get into the habit of being able to let go of those worries in the middle of the night. Stacey, we can advance. Other things that are helpful for managing your physical health, I'm not going to go into these a ton because this is kind of more Stacey's area of expertise, but exercise. Exercising helps to kind of burn off that extra nervous energy. It's also the best medicine for sleep. If you're going to be outside, you need to wear a mask if you can't stay 20 feet away from other people. So there are lots of low cost or free options for exercising indoors. YouTube is a great option for this. There's so many workouts on there. And again, I'm not going to talk about this one a ton because that's not my particular area of expertise, other than just to say you need to do it. Eat regularly, balance your eating. I'm hearing a lot of people say, it gets to the evening and I realize I haven't eaten anything all day because I've been so stressed. Eating regularly helps to avoid those kind of blood sugar crashes, getting hangry, stuff like that. Again, when you eat regularly and throwing a vegetable in there every once in a while, it helps reduce your vulnerability to negative emotions. So these are not things that are going to solve all your problems, but again, put you in a place to be better able to think through what to do. The last one on here is just, as best you can, avoid increasing your substance use. The resource list is going to have a lot of resources for sobriety support groups online. This has been a really difficult time for people who normally attend AA, LifeRing, things like that. They don't have their normal community. So it's been really extra stressful trying to deal with that. So there's some really good online resources for that. And again, substances don't help deal with the problem. They just put it off until later, which again isn't long-term effective. So we can move on. Reaching out to others is a big one. People need people. We're social beings. Right now, you can't be close to other people. And for some, that's been really hard, especially for extroverted people who get their energy from being around others. So we got to get creative about how we're connecting. When you reach out to others, it helps, to improve and strengthen your relationships, which helps to reduce loneliness and feeling isolated. Really, if you can do video communication, that's the best. You get more of those cues from other people. That helps you feel more connected and engaged. I know sometimes the technology can be challenging. If you can't do video, whatever way you can, email, text message, phone calls, social media can be kind of a double-edged sword. So if it helps you to feel good, great. If it doesn't, then avoid it. I think some people are kind of running into I've been talking to my family more than I ever have in my life since I moved out of the house. What do we do? Finding things to do together, apps like House Party, where you can play games together, or Jackbox is an online platform where people can play games together. People have really been getting creative with this one. So here, the only limit is your imagination. I know with my in-laws the other day, we all did a crossword puzzle together, which was kind of interesting, but it was fun, just to kind of all be connected doing something together. So again, video communication, getting those additional video cues can be really helpful. We can move forward. For those of you who are working from home, just a couple of things, and again, this might be stuff that you've already heard, just to help kind of create some boundaries and compartmentalization around work and home. It's important to have a dedicated workspace if it's at all possible. So I do my work over here, not in the middle of the kitchen table where kids, pets, whatever is constantly around me. If you can have a dedicated space, again, people have been getting really creative with this one, to do your work so that you can walk away from it, like driving home at the end of the day. If you can have a morning routine to help you kind of get into work mode, out of home mode into work mode, meditation, mindfulness, goal setting for the day, spend 10 minutes or so kind of blocking out and organizing your day, making your schedule, and then just kind of following the schedule. Just kind of helps to create a sense of I'm at work right now instead of at home. The last one here is important, and I think a lot of employers have been doing a fairly good job with this. You got to manage your expectations. Now that school's out, might not be so much of an issue, but if you're homeschooling your kids, managing your pets, and trying to work at the same time, you're not going to get as much done. And that's just how it has to be right now. So understanding I might not be producing at the level that I was when I was in the office, and that's okay. Again, I think a lot of employers have been pretty flexible with this and letting people kind of flex their schedules, or just understanding there's a lot going on in the world right now. We aren't expecting everyone to be producing at 100%. So just a few quick things for that. We can move on here. So here I've included a couple of things. I'm looking at the participants list. I don't know all of you. I'm not sure who has kids and who doesn't. This is something that I can include in the resources for kids. A nice thing that was shared by one of my coworkers at Jefferson Center, who works more with families and kids, got some links to what can you do with everybody at home all the time. Some things for all ages, some resources for how to talk to your kids about the pandemic. And then Stacy, if we move on to the next slide. Some more kind of age separated things, again, with some links. What's going to be appropriate for younger kids is not always going to be appropriate for, or, you know, teenagers can handle a little more. So if people are interested, I'm happy to share that resource, because I think for a lot of people, this has been a struggle, is what do I do with my kids? How do I keep them occupied? That kind of stuff. We move on to the next slide. I know this is a lot of text, but the American Psychological Association has put out 2 books directed at explaining the coronavirus for kids. Both these books are free and available online as PDFs, so I've included the links if people are interested in that. Again, I think a lot of parents are kind of struggling with, you know, how much do I tell my kids this is really stressful? How much do they need to know? This is a nice opportunity to work on talking to your kids about stressful and difficult things in a way that lets them know it's okay to be stressed sometimes, it's okay to be upset, and there are things that we can do to help us deal with those feelings. So if we move on to the next slide. So I know that we kind of blasted through a lot of stuff here, but if you're looking at this and thinking, okay, all of those things sound good, but I just don't think that's going to do it for me. I don't think it's going to be enough. I've been feeling really overwhelmed, really anxious. I've maybe even tried some of this stuff and I'm just feeling like, you know, my stress and anxiety is out of control. What can you do? So you can talk to your Westminster Medical Clinic healthcare provider about a behavioral health referral. With how things are going right now, we are wanting referrals to come through the providers just to kind of manage things a little better. So there's myself, who's available to see people, and also Bryn Jolly, who's a clinical social worker at the clinic. You know, our schedules are busy, but we've also got space. So if you're feeling like you need some additional support, go ahead and talk to your healthcare provider about that. I've also included the information for Colorado Crisis Services. This will be on the resource sheet as well. Their hotline number, they're available 24/7, 365. They are who answers Jefferson Center's phones when we're closed, so overnight. They've got, you know, peer support. They've also got licensed mental health providers that are available to help if you're in crisis. I also included a resource for domestic violence. This is something that's been really tough with the quarantine, people having to stay home when their home is not a safe environment. So there's some links here, both national and more local to Colorado. Violence Free Colorado is a website that kind of lists all the different resources that are available in our area. I think this is a big one, you know, both for adults and for kids as well. So just something to think about. If you're needing more support than just kind of managing on your own. And that brings us to the end of the slides. And with that, I think we are pretty much out of time. Stacy, I don't know if we want to do questions or
extra minutes for questions.
If anybody has questions. Nope. Okay, well, thanks for coming today, everybody. I hope this is helpful. Stacy's going to put the slides up on the website, and she's also, I'll have her post the resource sheet as well. Hopefully these things are helpful and things that will help you kind of better manage your stress through this stressful time. Thanks for coming.
Thank you, Dr. Hegland, and thank you all for participating and coming today. If you do have any questions for Dr. Hegland later on, feel free to email those to me and I'm happy to pass those along. It looks like one comment from the chat feature says thanks. So we'll hopefully see you all next week or the week after. Keep an eye on that website for upcoming webinars. Have a wonderful Friday.
Thank you.
Thank you.